Foremost, I want to give all honor and glory to Yahweh, Bahashem Yahushai, Bahashem Rakaha Kodash. Double honors to the elders and apostles of GMS who I learned from. Shalom to the hopeful elect preaching his word in truth and sincerity. And to you ribs, to you sisters out there learning in silence and staying in order, I say to you all, Shalom. Man, this article here, man, is, a testament to, right, that the Lord is really dealing with our people, man, and really giving us information, right? Because the prophets, right, that are out in the highways and the byways have been speaking on these things before they even had become a thing, right? Through the unicorn that the Lord allowed us to, push the information with, and also allowed Esau's tongue to fall upon themselves, right, to bring out this information and to warn the sheep, right? We've been saying for a long time that these vaccinations are no good. This is Marjorie Taylor Greene says COVID vaccines may be responsible for all-time cancer rates, right? There's a thing called turbo cancers, right? But really what they are is, I want you guys to go to Odyssey or even go on Google and type in died suddenly and watch this documentary of people doing autopsies, people who were vaccinated and had major blood clots from it, right? So there's a lot of issues here, man, with these vaccinations, and they're trying to depopulate the earth, right? The less people you have, the more control you have of the people, right? It says here, far-right Representative Marjorie Taylor Greene said C-19 vaccines should be investigated in light of all high time and cancer rates, despite it being a debunked claim, right? But these people who are debunking these claims are paid opposition. So the people who are saying that this thing has been debunked is paid by the state, and they're trying to debunk, doctors and, people who are well studied in these fields. And the people who are debunking them are just people on computers with no medical history, no backing, right? This is, quote, cancer rates are at an all-time high. The Georgia lawmaker wrote on X Friday night. In 2024, the U.S. is expected to see over 611,000 cancer deaths. Yeesh. Which is more than 1,600 deaths a day. Green stats appears to come from the American Association of Cancer Research, which estimated more than 2 million new cases of cancer will be diagnosed this year. There are, quote, there are many factors involving everything from bad food to low vitamin D. Right, vitamin D you get from the sun, right? That's the best way to get it. Right, our people are more inside. It's more computer jobs. Our phones are making us lazy, right? So people are not going out as much as they used to get sun. Right, there are vitamin D supplements, but I don't really trust those. Right, but continuing on, it says she continued. But I believe we must investigate the C vaccines. However, Green suggested that, quote, we must investigate the C to the 19 max to find answers for cancer rates is not based on any legitimate evidence, as C-19 vaccines have been shown to cause cancer. Both the American Cancer Association and the National Cancer Institute have made it clear that there is no evidence to support the claim that C-19 vaccines cause cancer or make it come back in a patient who is in remission. Right? Of course, they're not going to have studies to show otherwise, because they control the studies. Right? They control the information. But it's just you put two and two together, right? From 2020 to now, right? The spike is ridiculously high, abnormally high, and we could only assume one thing because the whole world had this vaccination, Right? It says people who are not vaccinated against C19 are more likely to experience the quote unquote most severe outcomes of the virus, which can include heart inflammation, hospitalization, and death, according to the Center CDC, right? That's what they said. It says more than 1.2 million people have died from C19 since 2020, according to the CDC. As of October, 11.2% of adults reported having receiving the 2024 vaccinations, while 20% reported they definitely plan to receive one, according to the CDC. Green isn't the only politician who has spread C19 misinformation. That's what they're saying, right? These are the people who are controlling the narrative and silence the voices. You're not going to see this in major news articles. You're all going to see control, opposition, right? Information, right? As Alex Jones calls it, info wars, right? Even the White House quoted that phrase, and that's where they got it from. It says Robert F. Kennedy Jr., a former independent contender for president and anti-vaccine activist who has since endorsed Donald Trump, falsely claimed, right? This is what they're saying. C19 vaccine is the deadliest vaccine ever made in 2021. This is yet another. You see, this is what they're trying to fight against, this information. Right, but it's too late. It's out there. Right? And people are getting hip. Right? You can receive it if you want to. But even they had admitted that it's not working.
Cases and a new variant called BA286 some 3.5 years since the pandemic was first identified. But if public health officials feel it necessary to ask America to mask up again, how many would comply? The Drudge Report led its website this morning with the headline, "Not Again, Mask Up in New York." Lead story at CBS News this morning, COVID hospitalizations on the rise as U.S. enters Labor Day weekend. The past several weeks have seen reports from all over the country of a rise in cases. And yes, the CDC reports COVID-19 hospital admissions are up more than 19% in the most recent week. In a few school districts, this has even led to canceled classes and sporting events. A handful of companies and schools have responded to outbreaks on their premises by reinstating mask mandates. Among them, several hospital systems, including Kaiser Permanente in Northern California, Morris Brown College in Atlanta, Dillard University in Louisiana, Lionsgate Film Studio in Santa Monica. But so far, those have been the few exceptions. And this graph shows how the current rise in hospitalizations compares to past surges, less than half the numbers this time last year and still lower than they've been for about 80% of the pandemic. But if things get worse, it may be hard to get people to revert to an abundance of caution. According to Gallup, in the first 2 years, public confidence in the U.S. healthcare system has dropped from 44% to 34%. And Donald Trump took to Truth Social to again make the issue political, accusing the latest outbreak to be hype designed to impact the 2024 election.
But to every COVID tyrant who wants to take away our freedom, hear these words: we will not comply. So don't even think about it. We will not shut down our schools. We will not accept your lockdowns. We will not abide by your mask mandates. And we will not tolerate your vaccine mandates.
Joining me now to discuss is Dr. Anthony Fauci. He, of course, is the former director of the National Institute of Allergy and Infectious Diseases. Dr. Fauci, nice to have you back. How worried are you that people will not follow advice to wear masks if we get to that?
Well, Michael, that's a very good question. As you said, if we get to that, I mean, we're starting to see a surge of cases, as you mentioned, about an 18 or 19% increase in hospitalizations, certainly going in the wrong direction, what looks like.
Which is a lie because, you know, they control the numbers, right? When it first came out, they were saying that millions of people were dying, right? They were getting truckloads of people, bodies out of a hospital, right? And then this reporter came out and filmed in that same location. There was nobody being taken out. There was no lines. There was no trucks, nothing. They did that all for staging. This is why we can't trust these people.
A late summer and into the fall surge. How bad it's going to get, we don't know. As you know, this is a very unpredictable virus has shown us that over the last 3.5 years. I am concerned that people will not abide by recommendations. And we're not talking about mandates or forcing anybody, but when you have a situation where the volume of cases in society gets to a reasonably high level, particularly the vulnerable, those who are elderly and those with underlying conditions, are going to be more susceptible and vulnerable if they do get infected to get severe disease leading to hospitalization.
Why don't you talk about the fact that you're connected to that Wuhan clinic that manufactured this disease in the first place? How can we trust you?
We know that. That's a fact. We've seen that. So I would hope that if, in fact, we get to the point where the volume of cases is such and organizations like the CDC recommend, CDC doesn't mandate anything, recommends that people wear masks, I would hope that they abide by the recommendation and take into account the risk.
They're not going to mandate it no more because nobody's going to listen this time around, right? You already got what you wanted. You got the people scared. You vaccinated them. There's no need for it. You know that people are not going to comply because it's just going to backfire on you. And it's just going to create your agenda much harder to accomplish. So you got to reroute. Man, you got to see this devil, for what it's worth, man. Like, don't trust anything what these people say, right? Isaiah chapter 30 says, woe to them to go to Egypt for help, right? Because you're going to be trusted in these fools.
To themselves and to their families. And again, we're not talking about forcing anybody to do anything.
Totally understood. There is a perception out there by many, how many I don't know, that they don't work and that the data concludes that they didn't work in the first go round. Respond to that on masks.
Yeah, well, that's not so. When you're talking about at the population level, that the data are less strong than knowing that if you look on a situation as an individual protecting themselves or protecting them from spreading it, there's no doubt that masks work. Different studies give different percentages of advantage of wearing it, but there's no doubt that the weight of the studies, and there have been many studies, indicate the benefit of wearing masks.
I'm going to refer to one of them. You've heard about it before. I heard about it from a number of radio callers. Brett Stevens in The Times talked about Cochrane. Put that on the screen. The most rigorous and comprehensive analysis of scientific studies conducted on the efficacy of masks for reducing the spread of respiratory illness, including COVID-19, was published last month. Its conclusions, said Tom Jefferson, the Oxford epidemiologist who is the lead author, were unambiguous. There is just no evidence that masks, make any difference. He told the journalist Mayan Damasi, full stop. But wait, hold on. What about the N95 masks as opposed to the lower quality surgical or cloth masks? Makes no difference. None of it, he said. Well, what about the studies that initially persuaded policymakers to impose mask mandates? They were convinced by non-randomized studies, flawed observational studies. How do we get beyond that finding of that particular review?
Yeah, but there are other studies, Michael, that show at an individual level for individual. When you're talking about the effect on the epidemic or the pandemic as a whole, the data are less strong. But when you talk about as an individual basis of someone protecting themselves or protecting themselves from spreading it to others, there's no doubt that there are many studies that show that there is an advantage. When you took at the broad population level, like the Cochrane study, the data are...
You see, it makes no sense what he's saying, bro. He's double talking now, right? It doesn't make sense. If there's no evidence that shows that it works or is effective, how can it work in an individual basis? It makes no sense. It doesn't work, period. How stupid do you think the people are? Well, they're pretty stupid because they actually go along with it, but, that's that fluoride brain.
Less firm with regard to the effect on the overall pandemic. But we're not talking about that. We're talking about an individual's effect on their own safety. That's a bit different than the broad population level.
Dr. Fauci, look back and reflect and tell me, how would you do it differently with regard to kids?
Right, I'm not even gonna entertain this guy anymore. We all know he's Dr. Fraud, right? Well, I pray this lesson was edifying. I want to give all honor and glory to Yahweh, Bahashim, Yahushai, Bahashim, Rakaha, Kodash. Double honors to the elders and apostles of GMS who I learned from. Shalom to those who like preaching His word and truth and sincerity. To you, ribs, you sisters out there learning silence and stay in the order. I say to you all, Shalom.